of the study are meaningful. I have to have low attrition during the study. So there's a number of different quality indicators that research must meet, and attrition would be one of them. So for evidence-based practices have to be supported by multiple high-quality experimental studies. And the last dimension of evidence-based practices are effect size. Practices that have a real small, so I'm going to give a drug and you just get a little tiny bit better. Or I'm going to, in my field, we're going to do a whole new teaching technique and go through a whole bunch of training, and kids end up reading 1 or 2 words faster per minute. It really isn't worth it. And this isn't an intervention or a treatment then that we want to promote and spend a lot of time training people in and putting a lot of effort behind. We want evidence-based practices to not only work, but to have a meaningful, robust effect on the outcome that we're targeting. And so if it just has a little effect, reduces illness or increases reading performance just a little bit, that's not good enough. And so evidence-based practices are supported by multiple high-quality experimental studies that show a meaningful effect. And so this is a very high standard for evidence-based practices, much more than best practice or research-based practices. So in summary, not all best practices or research-based practices are evidence-based. Remember when we talked about evidence-based practices are in some ways a subset of research-based practices, that these are the very best research-based practices. But all evidence-based practices are research-based. And also, they should be best practices too. And now I'd like to do our last pause, and this time it will be your choice. So you can either reflect individually and silently, review your notes, think about everything that we've talked about so far, or you can turn to a partner, or if the numbers work out, into small groups of 3, and quietly discuss what we've gone over so far. Take a look at your notes, see how they match up with other people that you're talking with, and just to ask any questions that you may have of each other. And so we'll take 2 minutes to do that, beginning now. Okay, that's 2 minutes, so let's get started. Now we're going to finish up by contextualizing this just a little bit. So now that we understand what evidence-based practices are, well, how is this all going to work? Is this going to is this going to magically transform medicine and education and agriculture and all of these other fields? Probably not. Interestingly, there has been, as much as in my mind, evidence-based practices make a lot of sense, there's been some reaction against them too. First off, evidence-based practices aren't guaranteed to work for everyone. Nothing is going to work for everybody. Whether it's penicillin, there are lots of people that have a reaction against penicillin. They can be allergic to penicillin, or it just isn't very effective for them. And so we've come up with a number of other antibiotics that work for them. Just like any reading technique, it isn't going to work for anybody. We're going to have different techniques to teach different kids. Evidence-based practices work for most people, most of the time, but when we're dealing with people, that's probably about as good as we're going to get. And so some people react negatively to evidence-based practices because they feel that this should work for everybody. And if it doesn't work for everyone, then it shouldn't be billed as an evidence-based practice, and we shouldn't have this kind of pushed on us to try to do. Similarly, there is a movement in medicine, in education, in other fields that say evidence-based practices ignore practitioner wisdom. That they're seen as, well, since we know nothing works for anyone, nothing works for everyone, that we have to let practitioners, whether it be medical doctors, teachers, farmers, they have to know their kids, their patients, their land, and they have to figure out what works best for them. And to some degree that's true. I think there has to be a marriage between evidence-based practice and practical wisdom and personal experience. And so the argument is, being a doctor is more than just looking up in a big book of effective practices and say, this works most of the time, I'm going to do this. Sometimes you really do have to marriage it with, I know you've been my patient for 20 years, and this is what I think is going to work for you. As teachers, sometimes it's also, that sounds good, but I know my teaching style, and that's not going to work real well for me. And so we have to make it work for the individual as well. And the last point is that evidence-based practices, like most things in life, aren't self-implementing. We can't just say, here's an evidence-based practice, you go do it. It doesn't work like that. And there's got to be a lot of training and a lot of support for people that don't use the evidence-based practice, whether they're medical doctors, teachers, farmers. They can't just overnight go up and say, okay, this sounds great, I'm going to do it. They've got to learn these. They've got to practice doing it. They need support doing it. And so change is sometimes very slow to come across. And if you've been a practicing doctor or teacher for 20 plus years and you've been doing things a certain way, very, very difficult to change sometimes. More reactions against evidence-based practices. One of the problems, not so much in medicine, but in my field in education, we don't have a lot of high-quality experimental research, and so we have relatively few practices that are truly evidence-based. And so we're going around telling people you should do evidence-based practice, but we really don't have that many practices that we can tell them actually are evidence-based. And we've hit on this already, but many practitioners are resistant to change. Change is hard, and some people, both in these professions, but in society in general, there's a little bit of hostility towards research. And sometimes we do want to go with our gut rather than do what research tells us. And so just because a body of high-quality research study shows that something has a strong effect on an outcome, that doesn't necessarily hold a lot of weight for some people. So some recommendations to finish up with here. If you're a professional in these fields and your profession has evidence-based practices, I would really recommend that you select them when they're available and relevant. And this doesn't mean that you need to go out into the research and find these things out for yourself. More and more different organizations are doing this. And so there's the Cochrane collaboration in medicine. In my field in education, there's the What Works Clearinghouse. And so these are available on the internet, and you can look them up and find out what works in your field. When something makes sense to you to do, when it's relevant to what you're trying to accomplish, evidence-based practices, in some ways, instead of making a 50-50 bet and saying, no, I'm going to try this. This worked once for me before. I've heard this worked. that's not those aren't great odds. When you're using an evidence-based practice, it isn't guaranteed to work, but it's a 95% bet, give or take. So I'd really recommend, when you can, use these evidence-based practices. If evidence-based practices aren't available, look to use research-based practices. Those are the next best thing. We have to be careful when we use research-based practices and really monitor whether they work. But we have to do that for evidence-based practices too, because nothing works for everyone. We do have to be careful when we select evidence-based practice. We can't just do everything because it's an evidence-based practice. We have to make sure that they match with your personal strengths and beliefs. If you're doing something that you really don't believe in, that you don't like, just because it's evidence-based, it probably isn't going to work if you're not behind it. If you're doing something that's evidence-based and the client, the consumer, the patient, the student doesn't need it, it doesn't make sense. You wouldn't give someone a drug to lower that you know is effective in lowering cholesterol if the patient doesn't have high cholesterol. So we don't want to just rush out and do evidence-based practices just because it's evidence-based. And then, just like we talked about best practice, soon got to be used by almost everybody to refer to almost anything. That's starting to happen a little bit with evidence-based practice. So just be careful. Just because you hear something is called evidence-based, make sure that it's based on a body, multiple studies, multiple high-quality studies, multiple high-quality experimental studies that show a large effect. Just because someone says it's evidence-based doesn't necessarily mean that it is. And so, in conclusion, I do want to stress that even though something's evidence-based, doesn't mean that it's guaranteed to work for everyone. And they actually have phrases for this. There are individuals who they refer to as treatment resistors or non-responders to even the most effective treatments. Nothing works for everyone. However, evidence-based practices represent practices that are the most likely to work. And so when they're relevant, they should be prioritized in our practice, and it'll make us more effective teachers, doctors, farmers, whatever profession that you're going to end up going into. Thanks for your attention, and I hope you enjoyed it. I sure did. Bye-bye.